Finding a doctor is hard enough as it is already. You want to make sure that you're going to be comfortable with that person.
The first thing a person's going to do is go online, you know, to find a doctor.
I chose to go into pediatric cardiology because I was born with congenital heart disease. I had complex cyanotic congenital heart disease.
I want to offer a friendly, unbiased environment where a person can come and tell me what's on their mind.
When somebody comes in, I want to understand exactly what their normal state of affairs is so that when we come out with treatment on the back end, we can restore that sense of normalcy to the greatest extent possible.
It's very important for us to develop a partnership with the patient.
Patients these days are very savvy with the internet. Patients are looking things up themselves. They come in with questions, which I think is terrific.
The photo and the text are very helpful in starting to narrow down and choose your doctor, but the video does bring it to another level. It kind of brings that personality and that profile to life.
It was really helpful to hear the physicians being interviewed and their responses to why they went into medicine.
As a child, I grew up with both environmental allergies and asthma.
How they approach the care of the patients in their practice.
In addition to surgery, I think it's really important to have some non-surgical options to offer your patients.
Those sorts of questions from the interviewer helped me decide if this was a person I would like to make my appointment with. I probably looked at a dozen or so before I selected Dr. Strauss.
That kind of depth of relationship and intimacy that develops between me and my patients is probably the part of medicine that I enjoy the most.
There were a number of specialists when I was looking for someone who had videos, and I felt like they wanted you to get to know them and feel good about them and start to build that relationship before you even see them in the office.
It gives you a level of comfort that before you even walk into the office, you feel like you sort of know this person a little bit. You haven't talked to them, but you've had a conversation with them in a way. They've talked to you.
I take pride in laying out the whole treatment plan with them. I'm always drawing pictures for them.
And when I actually met with Dr. Myers in the office, I felt very comfortable with him. And I was able to go back then to my family and say, this is the doctor that is going to do my surgery. Here's a video that he's prepared. I think you can tell from the video that this is somebody who knows what they're talking about.
When people are given referrals, it's a very personal thing. If I refer my best friend to a neurosurgeon, I'm taking on some responsibility for that, right? What if it doesn't work well? So I want my friend to be able to make his own decision. So by being able to send a link that'll give them a lot of information about the doctor and they've got a video, they can make their own choice.
It's really gratifying to see how often we can return patients to feeling better and doing the things that they enjoy the most.
One of my favorite patient expressions is, I wish I hadn't waited so long to see you. If I had known this was possible, I would have done it years ago.
It's very important, I think, to have this tool, find a doctor, to take the first step into that journey of healthcare.